A very warm welcome to the 75th Platinum Jubilee CSI Conference at Kolkata 2023. It is my honor and pleasure to welcome Dr. Vivek Gupta, sir. He is a senior intervention cardiologist at Apollo Hospital, New Delhi. Sir, very warm welcome and thank you so much for your time. Sir, I wanted to ask you regarding a very pertinent question in the management of CCS. Where do you place the medical therapy and PCI versus only medical therapy in the management of CCS?
It's a very burning question. Actually, I am Professor Dr. Vivek Gupta, Senior Cardiologist in Delhi Apollo Hospital. I do angioplasties. I am an interventional cardiologist. And this is a very important topic which you have asked. That means medical therapy versus angioplasty and medical therapy. That means medical therapy alone in a stable coronary artery disease. Stable patients are actually those patients who have got stable angina. They are not converting into acute coronary syndrome. But stable patients may not remain stable for years together. It has been shown that many stable patients who are stable for 1 year, at least 20% will become unstable in the next year, and they may have heart attack, they may have angina. There have been 2 trials which have actually caused so much of turbulence in the mind of physicians, and one trial was Courage trial, where they compared optimal medical therapy with angioplasty, and they found that angioplasty does not decrease the major adverse cardiovascular event. Second trial was ischemia trial, which was published in 2020 in New England Journal of Medicine, and they compared the conservative treatment, that means medical therapy, versus aggressive treatment with angioplasty. They also did not find any major advantage of angioplasty. So that caused a lot of confusion in the mind of physicians, cardiologists, whether you should do angioplasty or not. So my final conclusion of this talk, which I have just delivered, is that all stable patients, actually stable patient is a myth. All stable patients will not remain stable. It is the discretion of the physicians and cardiologists, because there are 2 important pitfalls in these 2 trials, Courage trial and ischemia trial, and they have not enrolled a severely symptomatic patient. They have taken only mild patients. And secondly, in Courage trial, they have used only bare metal stent, not the drug-eluting stent. And that is why the advantage of angioplasty has not been there. This is my personal thought process. I personally feel that I will advise to a young cardiologist, use your brain, see the symptoms, see the patient profile. If the patient is high risk because of family history or because he is diabetic, he has got a possibility of triple vessel disease, then please try to do intervention rather than just controlling on medical treatment. A lot of patients will lose over many years if you do only medical treatment, and many patients will have acute coronary syndrome and they may not reach hospital, they may have acute MI. So finally, I conclude that patients who are stable may not remain stable. You have to see the patient clinical profile. You have to see the individual patients accordingly. If the patient is diabetic, hypertensive, obese, with a strong family history, he may be stable today, but he will not remain stable tomorrow. He should be subjected to coronary angiography, and depending upon the blockages which you see, you will take a decision whether angioplasty should be done or not. Thank you very much.
Thank you, sir. Thank you so much for that valuable insights. Thank you.